Good morning, everyone, and happy Sunday. This is the channel, Shelley's Millions, where we talk about money, finance, budget, credit card points. We talk about movies because my regular job is managing a movie theater, and whatever you guys want to talk about. Sometimes we talk about just things going on in my life. For example, a lot of you know I'll be going to Ireland soon. I'm really excited about that. A lot of you are recommending the Cliffs of Moher, and, my big question there was, should I go the day after I fly in? And you guys say, "Yeah." The reason why I was concerned about that, hi, Levon, good to see you. Um, the reason why I was concerned about doing that is I just am not sure. It's a long flight. It's an 11-hour flight. It is a nonstop flight that we're doing there on Aer Lingus. But we're flying from LAX, a friend and I, over to Ireland. We'll get in Saturday, we'll stretch our legs, but then the very next day, it's like a long drive on a tour bus. My logic is that I won't be used to their time zone yet. It's like you have to get up really early in the morning because, like, they have to pick everybody up, you have to load on the bus, you have to drive over there. But, like, since I won't be used to the time zone there, like, I'm gonna be all screwed up anyway, might as well get up really early and go see the Cliffs of Moher. But I'm gonna have a confession. I'm one of these people, sorry, I'm gonna talk about vacation until, you guys get me off track on something money related. And hi, Richard, it's also always good to see you in the chat as well. Um, and I can share some of the things that I'm doing to save a little bit of money on the trip. One of them one of my tips is actually right back there on my bookshelf, and that is, get your travel guides, from the library. I still enjoy it's been a while since I've gone to the library. I had to get a new library card because I think it's been more than 5 it can't be more than 5 years. Because I remember going to the library when Jenny Silver wrote her children's book. Maybe I just donated a book, maybe I didn't check anything out. Anyway, it's been a minute since I've been at the library. They made me get a new library card because 'cause I'm not on their files anymore. But I've checked out this book from the library because I don't wanna pay for a travel guide that I'm just gonna use for this one trip. Maybe I'll go back to Ireland. I feel like I'm gonna love it. Already feel like I wanna see everything, which isn't possible. Um Oh, hi, CW. I'm glad that thank you for subscribing. It is good to see you in here. I'm excited about an upcoming trip that I have, so I'm babbling about that. But if you have any questions about money, finance, credit cards, that's really what I'm passionate about. So feel free to just ask in the chat. My mom, a lot of you guys found me because my video where from my mom, where she's living on Social Security only, and that's still the case. She has moved in with me now. Maybe I should give you guys life update on my mom. She lives with me now. She pays me rent. She does not have to pay me rent, but she does, and I'm not gonna lie, I like it. It partially goes to, like, utilities and things like that. We share, expenses. The good thing about living with me here is, 1, I'm not gonna, like, raise her rent, right? So, every year at the trailer park, it was going up. It's not gonna go up here. The other thing that is good about it, well, there's good and bad things about it. It's good that she's not driving anymore. So, she's saving money on that. Hi, Cindy. And car insurance and gas and upkeep on her car, but she really misses her freedom. So that's kind of, and it was just like a lot, she moved and she gave up her car all at the same time. So that's been an adjustment, but she's coming up on that year. That is, if we don't talk about my vacation today, that is kind of what I had in the back of my mind that we would talk about is the changes to Medicaid. Okay, a former spendaholic. All right. Well, sure. So it's funny because we all kind of give the same advice, people that talk about money on YouTube, which is pretty much start a savings fund, whatever you can, um, because you wanna have money for emergencies. And then the other thing is, you know, so I've got Beanie Babies up there, right? I have not been perfect my whole life. I was in my 20, I might have still been a teenager. I might have been like 18 when um when Beanie Babies came out. And I would say in my teens, when I was in community college, I was not perfect. I Cindy, I will tell you in 1 second about that. So I have not always been perfect. I also used to get a lot of Starbucks when I was in my 20s going to community college. I always heard, this is what got me to save at a young age, is I had always heard that Social Security was gonna run out. Now I understand it's not gonna completely run out. It's not like you're gonna have nothing from Social Security. But right now, let's say you get $1,000 now. That that's hypothetically what someone who's 62 gets. Most people get a little bit more than that, right? But we're just doing that as an example because I can do the math on that pretty easy. Maybe by the time I retire, instead of getting $1,000, maybe I get 75% of what would be available to previous generations. So maybe for me, by the time I'm retirement age, maybe uh-oh, Joel, high blood pressure. Give me 2 seconds because I also have high blood pressure. So we talk about lots of things on the channel. Um, I had always heard that Social Security was gonna run out. So maybe by the time I retire, maybe I'll only get $750 a month. So I started hearing that when I was like 18, 19, 20. So as soon as I could, I started contributing to a 401k. And I am luckily at the point where I feel like I will at least be able to survive when it comes to retirement age. But I'm still gonna need whatever amount I can get from Social Security, but it's not quite as bad as I thought it was gonna be. Also, every year the amount seems to go up, so hopefully by the time I retire, it'll be even more. And again, that was just like an example. Okay. Yeah, so Cindy, let me know your specific questions, but get a savings fund going because a car repair, something like that really takes you out. Also, all the advice that I give to my viewers, if you have anything like a car that's financed, call around, especially to credit unions and see if you can refinance your car. I've saved people money that way. Shop your car insurance. I know I'm in Los Angeles County. For me, Geico is the cheapest car insurance, but call around and get estimates. Just take the time to do that. And then right now I'm also optimizing. I'm fortunate, I'm able to pay off all my credit cards in full every month. So currently, like for the trip to Ireland, I'm optimizing, and I didn't do this before. And I would never encourage people to open credit cards or spend money just to get like a sign up bonus or something like that. But sometimes, let's say you have a really high interest credit card. Let's say that you have a credit card and you notice that you're paying more in interest than your minimum payment. And so your balance keeps going up. In that case, what I did, right? Because I had that happen back in my 20s when I spent too much. I would find like a 0% balance transfer option for a new credit card. And I would open a new credit card with that 0% transfer offer. And I would take anything that was not at a 0% interest and I would transfer it over to the new credit card that had 0% interest. And then I would work my tail off to pay off that credit card before the 0% interest rate ran out. And if I couldn't, like 3 to 4 months before the 0% interest rate was gonna run out, I would start shopping for a new credit card that would also offer a 0% interest rate. That gives you a little bit of breathing room to get caught up. If that's something that you did, right? And I'm not a financial advisor, so I guess I'm just sharing what I did. to lower my expenses and to get my budget back into control. But if that's something that you wanted to do, make sure that you don't spend on the new credit cards, and that's or the old credit cards that you're paying off by using the balance transfer. And then just really, I didn't need those Beanie Babies. Now they're just sitting on a shelf. PS, a Labubu is just the new Beanie Baby. Do I kind of want a Labubu? Yes. I think I'm a consumer at heart. I'm brainwashed by all these images that they put in front of you. But I don't need those things, you know? I absolutely want them, and it's okay to treat yourself if you can afford it, but get out of debt first and be very I don't know a lot about being a spendaholic. I think maybe sometimes I think maybe my mom might spend money when she's bored, like on Amazon and stuff, but she has it. She's able to do that now. Okay. Joel says that he has some bad news. You want to go get your high blood pressure checked and it's a bit high. You have to make diet and lifestyle changes and small doses of pills daily. Check yours, it's important. So, Joel, I am 48, and I want to say that right about when I turned maybe 38, so maybe 10 years ago now. How has it been that long? I was diagnosed with high blood pressure, and it took them a long time to kind of get it down and manageable. Um, and I've not really, I think ladies, not I think, well, I know from what I've read, we have, as we get older, we have other factors that like contribute to health changes. And so for me, I think that plays a factor. I think definitely my weight plays a factor. I'm sure my diet plays a factor. And my job is sometimes stressful, even though it's a movie theater. I'm stressed out today and I'm not even there. We have a film festival going on. Um, my coworkers are there running it. I know they've got it, but they've been going nonstop for the past 3 days because before the film festival, we had an event with catering. We don't do catering a lot, so it's always a little stressful when we do catering. Like, are we gonna get it right? We did. We always knock it out of the park. But, it's stressful because we don't do it every day, so, um, it's like, okay, have the new people done the catering events before? But you do them and it's not the end of the world. But it does get stressful. I'm also stressed because I know that we had 2 people call out sick today, and so I'm like, "Am I gonna have to go in? Are they okay over there?" Like, I'm just a worrier. I'm sorry to hear that, Joel, but, thankfully, we have those advances in medicine. Okay, Cindy wanted to know who will check on my mom when I'm on vacation. And my best friend that rents the garage for work from home. Also, like my phone will be working. Also CW, Mint Mobile cell phone, right? For a long time, I had like a $78 phone bill. Now I do have to pay it in advance, but I just use Mint Mobile. And it's $30. Uh-oh, work is texting, so I better read it. Uh-oh, uh-oh. Oh. Oh. Oh my goodness. Okay, so I have good work news. Less stress. So, remember 2 seconds ago, I was like, "Oh, we're doing a film festival." And this woman, Patricia, probably shouldn't have said her name. Anyway, whatever. There's lots of people named Patricia. She left her laptop and her iPad at the the theater, she thought. And she's super they're super tired because they've also been going nonstop. Festivals are a big deal. You're showcasing films for the first time, you're getting all this different content in all these different areas, and she thought she left her laptop and her iPad at the theater, and we were looking all over for it yesterday, and we didn't find it, but, we have really good cameras where I work, and my coworker did some camera digging. They left with it and didn't bring back in. Turns out it was left at Trader Joe's, but it's been recovered, so that is so awesome. I don't know how you gotta be real tired to leave your laptop and your iPad at the grocery store, which is, like, right below us, but I'm so, so glad that they found it and, like, I have the best assistant in the world because, like, he's on empty also, and he is, taking time looking through the cameras, making sure that we have, like, just the best customer service ever, so that's super awesome, and I'm really happy, and I'm less stressed because, like, when people lose things at your business and you don't find them, you always think that they think it's you, right? Like, and my staff is so honest, like, they're so good, and that's something that I'm really proud of, right? Like, sometimes I think maybe all managers can't say that about their staff, but I 100% can say that about my staff, that they're really honest and that I trust them, and that's such a nice thing to be able to say. I'm gonna cry. I'm gonna cry because I'm happy that my staff is honest, but I'm also glad that we found it because, of course, you're gonna think that it's us, right? But I knew it wasn't, like, also our customer base is pretty good. It's like we get so many, like, valuable things turned in our lost and found. I just, like, for all the reputation that LA has about, like, people, like, not being honest and people trying to scam you and just all of those things, I feel like maybe it's because, like, I speak it into existence that we have good customers, that we have good staff, that we have honest customers and staff. Um, all of their attendees to the festival have been really great. Maybe I'll show you one picture. Let me show you one picture from the festival. This woman is gorgeous. She was in the short. I don't know if you'll be able to see it, but we're gonna try. So we're doing this Cine Pride Film Festival right now, and she was serving looks. Okay. So, okay. Okay. All right. Linda is saying, Joel, assuming your high blood pressure is 140 over 90, that was like me. It was slightly high, so to take small doses of meds and have to watch what I eat. High blood pressure can kill you. Be careful with it. All right, and CW, that's on my I have a vision board. I do a vision board every year that I just update with you guys. My number one thing this year is health is wealth, right? You have to take care of your health. I'm not following that as well as I could and should be, but I do strongly believe that it's important. I also believe, and I wish that someone would have drilled this in for me a little bit more when I was younger. People do judge you by your outside appearance. So, unfortunately, um oh, no, I can't take it. Uh, unfortunately, hang on, let me see if it's 911, you guys. It's the code. Sorry, 1 second. He's like, "Don't talk about me on your YouTube." No, they don't care. Um, so people judge you by your outward appearance also. So, unfortunately, what I'm presenting to the world is that I don't value myself because I'm overweight, and that's so terrible. Um, it's terrible that people judge you like that, even if it's subconscious, but it's important. I wish it wasn't, right? I grew up, and my mom is so wonderful. I grew up with the message that people will love you for who you are, that the right people will not judge you on how you look. And while I want that to be true, don't I don't think it is anymore. So really, and there are things going on internally that you can't see that are better if you get some exercise, and better if you improve your diet, and better if you t- take and make the time to do that. And this is something I'm struggling motivating myself to exercise. And I actually love exercising. I'm tired. Today, I'm tired from this festival and just from, like, jobs in general. Also, my shoulders hurt right in here. It feels like they're burning. Okay. Sorry. Sorry. Work stuff. This is why I'm stressed. But also, like, not so I'm like, great, things are great now. Things are not great. It's okay. They've got it under control. I'm just burning in my little shoulders right here. And I don't know what that is. And I've read it, and And I slept wrong, guys. Oh my god. I slept wrong. My jaw got out of place, and I'm not able to close my teeth together on this side. So I'm chewing on this side, and then, like, my whole mouth isn't closing, which I need to fix before we're gonna tie everything back to Ireland today, because that's where I'm gonna go later this month. I don't wanna be in a restaurant and be chewing with my mouth open, and I know we're gonna go out to eat, like, I could cover my I don't know. I need to make time to figure out what's going on with my jaw. It definitely like, it's almost like it detached. It got out of place. I sleep on my stomach and I sleep like this. I must have, like, pushed it, like, up and out of place, and now my teeth won't close. Anyway, um, go to your doctor's appointments, right? Mom, if you're listening, go to your doctor's appointments. They're not gonna be perfect. They don't know everything. They don't. Like, medicine is still evolving, and you hear so many stories on TikTok about how the doctors got it wrong and how people really had to advocate for themselves and, like, keep going back and keep pressing until they got, like, the correct diagnosis, and I think that that is frustrating, but I think it's important to try and take care of your health. Okay, I've been rambling. Let me try and speed up a little bit. Okay, Richard says that he goes job hunting regularly. He can't even get a job interview. You have restrictions due to arthritis in both hands. I have trigger finger in my thumb and my middle finger. It is in both hands. I'm gonna eventually need surgery on it. I don't want surgery, I'm scared. I was supposed to have it on the 4th, but it got postponed, mostly because I'm scared, partially because I'm a little overweight. Your weight and your health can affect whether you can have surgery also. So just like, I'm also trying to motivate myself to get at least a 15-minute walk in a day. I am pretty active at work. I'm on my feet a lot. I'm moving around. We're getting stock. I'm helping guests. I'm scooping popcorn. As a manager, I'm still doing all those things. But I need like 15 minutes a day of uninterrupted exercise. I think this is motivating me, like realizing like it's just 15 minutes would benefit me. Um, okay. Lots of great questions in here. Uh, yeah. Anyway, you do not have to disclose anything like the arthritis in your hands. You don't have to disclose that in interviews. Um, I I feel like I have a video up about writing a resume to like get it through. And honestly, it's interesting because this is just my experience. I don't know if this is going on everywhere. A lot of people are my coworker blowing up my phone. I need to put it on do not disturb. Um, a lot of a lot of entry level jobs are getting hundreds of applicants. I saw a TikTok that said that somebody applied for a part-time position at Sephora and that position got like 250 applicants in like an hour because you can see like on Indeed, I think it's like quick apply where you can see how many people have like already applied. My foot fell asleep. How's that possible? Probably because my health's not great. Anyway, so you can see how many people have already applied and you can see how long the job's been posted. So she said that like 250 people applied for this job, an entry level job as a sales associate at Sephora in like an hour. And we're not quite getting the same amount to come work at the movie theater, but it's a lot, right? I can't go through 250 applications, right? Certainly not with the detail that you'd want when you're hiring people. So we're actually going back a little bit to people that are calling and following up and people that are showing up in person. I'm going to share some things that I don't know if I should share. I used to not like that. Sometimes I'm very busy. So sometimes if somebody comes at the wrong time, like be mindful of where you're applying. For example, movie theaters were really busy. We were really busy from 6:30 on a Friday and Saturday to like 8. It's probably true on the weekdays too. We're just going to be busy. I'm not going to be able to like speak with somebody. So be mindful of the nature of the business that you're applying at, and try and go like when it's slower so that people will have time to interact with you, but go in person and say, take a physical resume again, because then, right, I have an idea about, like, how friendly is this person? Like, you know, are they gonna be, like, nice to customers? Like, you can get a lot out of that first interaction, and while I'm not saying, like, make snap judgments or don't give somebody a fair chance, um, sometimes getting in front of the right person can make a difference, right? Especially when we're getting so many resumes. Um, my assistant that's, pinging me right now, he's wonderful. He had applied, I wanna say something like 3 times, and nobody had called him back, and he called. He called several times, but one of the times when he called, I think he just was applying for floor staff. I don't even think he was applying for a manager at the time. But we were talking and he said, "Oh, yeah, I used to be a manager at another chain in Florida." And I was like, "Oh, really?" I was like, "Do you happen to have projection experience?" And he said, "Yes, I love projection." And that's where I'm, not as strong. I'm great with customer service, I'm great with the staff, I'm great with the customers, I'm great at, like, the paperwork and turning in reports on time. Technology scares me a little bit, and projection is all digital. I can still do 35 millimeter, I can do actual film, and he can't, but I don't know, like, the technical side of things, and I'm intimidated by it. But he's really good at it, and so we were able, because he was calling and following up, we were able to do that. We were able to get that out of the way, and I passed him forward, and I was like, "Let's hire this guy," and he's been wonderful. Okay. Richard saying, "It is a mistake to be loyal to an insurance company, they're loyal to nobody." That is correct. So, yeah, shop your insurance rate around. Okay, Prince Ali says, "Is and this is kind of what I thought I wanted to talk about today. Is Medicaid going to go away in California if you're lazy and don't work? You think so? 80 hours a month worked or $580 of income minimum per month." And Prince Ali, it's always good to see you in here. It's been a minute since I've seen you in here. And I just want to again really briefly share the story of my old coworker who he takes care of his mom, but not full time. His mom lives out of state and he lives here in California. And he regularly travels, like at least once a month, and he's there for at least a week, but sometimes two. Sometimes he ends up staying the whole month. And he gets her caught up on doctor's appointments. He makes sure that she has everything that she needs. He sets up her in-home care. He, makes a plan. He calls her doctors. He eh, does all the things that she would need, but he's not there 24/7. Now he makes arrangements to make sure that someone is there, that someone's taking care of her. Like, he's a wonderful son. If you're listening, you know that you're doing good and you're gonna be glad that you did this. But it's hard, right? So he's still trying to maintain kind of like a balance. Just, he has a partner here in LA, like, so he's trying to give time to the relationship and time to the mom. But because he's traveling back and forth so much, he's not really able to work, right? What job's gonna let you go at least once a week every single month, and then sometimes your stay gets extended? I don't know any jobs. I mean, I guess technically a remote job, but when he's there, he has to be paying attention to her kind of full time. So that can be anytime for a week. It can be for a month. And when he's taking her to doctor's appointments and stuff, like, that's going to be 9 to 5 when most jobs are, not all, but most. So what happens to somebody like him? And I feel like a caretaker probably would qualify. Like, I know that there's some circumstances that qualify, but because he's here in California and she's there in Alabama and he's not her official caretaker, like, I'm nervous for him and his healthcare situation. So, I'm sure that there's other things like that where there's going to be some reasons. I think schooling counts. I wonder if his mom paid him $580 a month. and he declared that as income. I wonder if that could work. I don't know. I'm gonna take a sip of coffee. If you're enjoying this, please take a moment and like the video. But I did want to look at Medicaid and the cuts because what I'm starting to see, and I haven't had time to thoroughly research it, which I like to do. And you know what? Sometimes thoroughly researching it means Googling it, but Googling it and then trying to find articles that are reliable, not just listening to the AI overview, which sometimes I do just to be quick on live. But sometimes um oh my god, I totally lost my train of thought. Sometimes talking about Medicaid. I don't know. I'm gonna have to let that thought go. I need a sip of coffee. Okay. Cindy says, I dreamed of having a fun retirement job. Reality is I have arthritis and my husband is on a low sodium diet, which means making meals from scratch. Nothing I planned, but I'm not sad. Yeah, I'm glad you're not sad. I don't think things really I didn't plan to be at my same job forever, but I didn't necessarily have a plan, but I'm doing okay, you know? I think we're all just doing the best we can, and I don't think most people have a plan. Maybe I'm wrong. I don't let me know if you have a plan. I don't My plan is to, like, get up and make it through the through the next day, to not fall over at work, and maybe to, like, figure out how to make it so that dude, I, like, feel something right there. My little shoulders are, like, burning right there. Anyway, so go to the doctor before I get on the plane to Ireland to figure out why my shoulders are burning and why my jaw is not closing right. Okay, Joel says, I feel like with all this good food in America and high-paced life, everybody probably has high blood pressure. So you have to take medication for it daily. I do, yeah. I'm on amlodipine. I'm on 10 milligrams, which is up from the 5 milligrams it used to be, but because the 5 milligrams unfortunately wasn't lowering it fast enough. And I'm 48 and I've been on it for a while. So yeah, and then Steve's saying hawthorn berry lowers blood pressure. I have some tea that's supposed to lower blood pressure. Cindy says most of the food, meaning processed food in this country, is loaded with sodium. I wonder if this is why people have high blood pressure. I mean, I'm sure there's lots of reasons, but yeah. So something also with my trigger finger is what is it called? An anti-inflammatory diet, which I've since given up. I had Taco Bell yesterday, but um because anti-inflammatory seems to mostly just be fruits, vegetables. Like I was like, what do I even eat for protein? Um, but really eating and the thing is, right, I love Taco Bell. Taco Bell has a lot of sodium. Also, I don't know how accurate this is. Frozen meals, right, which I used to eat a lot of in my 20s. Frozen meals have a lot of sodium in them, I guess to preserve them for longer. I don't know exactly. But, an old coworker of mine, he noticed that, like, if you get a frozen meal from, like, Trader Joe's versus, like, a frozen meal from regular Ralph's, it's not called regular Ralph's, it's just called Ralph's, but, like, like, probably, like, Healthy Choice, Lean Cuisine, I hate to name names, but, like, I'm naming names. Their frozen meals have more sodium in them than the frozen meals at Trader Joe's. So look at different brands, all that kind of stuff. Ironically, like, my doctor never really discussed changing diet. Like, I know that I need to, but she didn't really focus on that. She's just like, "Here's this pill," which drives my mom crazy. It drives my mom crazy when they're like, "Here, just take this pill to fix it," instead of addressing the underlying cause. But, like, I know I need to avoid sodium. I just don't. Okay, Joel says, to be a caretaker, you actually have to be recognized by the county, not just living with old parents will work for these people, I guess. I don't know. Yeah, I don't know either. So maybe people will go through that process. Um, let's look a little bit about the Medicaid. And then I see Debbie's in here asking for the movie chat, so maybe we'll do that really quick. Ba, 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 ba. Share my channel page real quick. Uh, Okay. So, oh, I had to say this on the recording, and I'm not sure if I'm saying it right. So, number one movie. It's I think this is the third part in a series. Demon Slayer Kimetsu no Yaiba, the movie Infinity Castle was the number one movie. So it's an anime. Number two movie, Conjuring the Last Rites. Debbie, have you seen that? It's very overcast here in LA today. I'm excited. It feels like it's starting to be fall. It feels like it's starting to be Halloween season. And I'm wondering if that's why my shoulders are burning. Okay, anyway. Number three, Downton Abbey, the grand finale. Number four, The Long Walk. Five is Toy Story. That must be a re-release, obviously. Number six, Weapons, which Debbie, you said you didn't like that? Was that the one you Oh, no. You did like Weapons. You didn't like Sinners. Okay. Number 7 is the Hamilton re-release. Number 8 is well, not re-release, first time in theaters for Hamilton. Number 8 is Freakier Friday. Number 9, Spinal Tap 2, The End Continues. And number 10, The Sound of Music. That's interesting. Hold on. Where's Jaws in this? Maybe Jaws is way down there. Oh, I'm going to sneeze. Ow. Oh my God, guys. Also, remember how I said that my jaw's not lining up? So sneezing is also like triggering that. Anyway, okay, so that's the movies. Let's switch back to Oh, I know what my thought was when I lost my thought. Okay, so I'm starting to see TikToks about healthcare waits are about to get longer because they're maybe going to be cutting payroll, and so it's going to take with less people, I guess, insured, like hospitals will be able to like staff less, I guess, and so that's going to make the wait for everybody longer. That's how I interpreted that. I'm gonna take another sip of coffee. You guys like the video? And CW, please let me know. Um, as a spendaholic, what were some of the things that were triggers for you, and what are some of the tactics that you have? Also, I'm gonna look into that. Also, I'm gonna also say that along the health is wealth, a lot of the behaviors, right? And I'm no expert, but I read a lot of self-help books these days. A lot of the behaviors are trying to replace a feeling or get that dopamine hit. A lot of it, it's so the advice is gonna say, like, go take a walk, journal, um, some positive behaviors that are free. Walking, writing. Okay. Now I need to walk more too. So like, I'm right there with you. I'm not trying to say I'm better than anybody else by any means. Okay. Joel says 10 milligrams is small compared to like what Tylenol or other pills have, 500 milligrams or more. Yeah, I do not understand like the doses of medicine. I'm also taking another medicine that's like 10, no, it's 5 milliliters and it's a liquid medicine and like that thing is so small. Okay. What changes are coming to do we want Medicare? Let's do Medicare and Medicaid. We're gonna do the AI version. Let's use the AARP. No, that's for 2025. Okay. Let me know which one of these you might want me to read. I normally like a .gov website, but I'm not Medicare cost and benefits. Medicaresources.org. Center for American Progress. Medicare.gov. That seems like it would be like the legit one, right? Oh my God. Oh, my mom just got this. I should have. Oh, she hasn't thrown it away. What's new and important? Capping what you pay for prescription drugs. If you have Medicare drug coverage, Part D, your yearly out of pocket Part D drugs will be capped at $2,100 in 2026. Once you reach that cap, you won't have to pay a copayment or coinsurance for covered Part D drugs for the rest of the calendar year. So that seems good. So 2100. So what's that saying is the most you would have to pay. So 2100 divided by 12 because we're going to do it monthly. So the most you would have to pay for covered medicines would be $175. So that seems good. Oops. Okay. Meeting your health, Medicare now pays for advanced primary care management services each month, where your doctor or other healthcare provider coordinates and tailors care to your needs. Providers that offer these services must give you 24/7 access to your care team or provider. Early detection, um, colorectal cancer screenings, computed tomography, colonography. Getting screened is an important part of cancer prevention and early detection. Guys, this is one that I have been putting off, but let's put it as a 2026 goal because I feel like we're already too close to the end of 2025. Apparently, I'm old enough to need to get my bum screened. I don't really want to get my bum screened, but health is wealth, right? And I want to set a good example for you guys. I got to get my bum screened, I guess. I don't want to do it, not at all, but it's important. I have a friend, she's a coworker who turned into a friend. I have known her since I was 20, so 28 years now. She just found out that she has breast cancer. It is early detection. They say, it's the best thing possible for her that they found it early, that she's been good about getting her annual screenings, but unfortunately it's turned out positive. It runs in her family, unfortunately. Okay. Help Medicare fight fraud and cut waste. But then it says protect yourself from fraud and medical identity theft by checking your Medicare summary notices and your receipts. What's new and important? There's too many keys already. Look for these symbols to help you understand. Compare shows you how key features different between original Medicare and Medicare Advantage plans. Index of topics. Okay. Oh no. Federal employees, EKGs. We're not going to have time to go through this whole thing today. Okay. Oh, here, I don't know the answer to this, so we're gonna look at this one for sure. What are the parts of Medicare? Part A is the hospital insurance, which helps cover inpatient care in hospitals, skilled nursing facility care, that's in blue. I wonder why that is. Hospice care and home health care. Part B is the medical insurance, which helps cover services from doctors and other healthcare providers. Oh, I remember what they were saying. They were saying that a lot of the money that hospitals get are from Medicare and Medicaid. And so when they cut that, and then hospitals will be receiving less money from that, then they'll staff less. And then that's going to mean longer wait times for everybody. That's what the thought process was in that TikTok. And again, I have not done a lot of research. Obviously, it's a TikTok. So we're going to take that with a grain of salt. But that is something that I said that I was worried about even kind of before this. All right. So the medical insurance helps cover services from doctors and other healthcare providers, outpatient care, home health care, durable medical equipment like wheelchairs, walkers, hospital beds, and other equipment, preventative services like screenings, shots or vaccines, and yearly wellness visits. And then part D is the drug coverage, which helps cover the cost of prescription drugs, including many recommended shots and or vaccines. Plans that offer Medicare drug coverage, Part D, are run by private insurance companies that have to follow rules set by Medicare. Your options, When you first sign up and during certain times of the year, you can choose how you get to your Medicare coverage. There are two main ways to get Medicare. Do you guys so I haven't looked a lot about this. My mom, a lot of what I have been able to figure out is from personal experience. And in my personal experience, a lot of the stuff about healthcare comes from what I've watched my mom get. But my mom has VA pension, so my mom goes to the VA hospital. So she's as a matter of fact, my mom has to fight, like, somewhat routinely because sometimes Social Security will automatically see that she's not enrolled in Medicare, make some choice for her, and then her Social Security check is a little bit less or something weird like that. She'll explain to me what I've got wrong about that once I'm done with the live. But, so she'll have to go and be like, "No, I don't have to pay for that. No, you shouldn't be deducting that because I do have medical coverage, but it's for the VA." So that's why I'm not as familiar with this as I feel like I would be if my mom was not, covered through the VA. So let me know, like, it if any of you are on this, like, which one you have and break it down for me a little bit because it helps me be able to explain it to others if I have, like, a a living example, you know what I mean? Okay, so 2 main ways, original Medicare, which includes Medicare Part A, hospital insurance, and Part B, medical insurance. You can join separate Medicare drug plan to get Medicare drug coverage, Part D. You can use any doctor or hospital that takes Medicare anywhere in the US. Oh, is this just like in-network versus not in-network? You can also use or shop for and buy supplemental coverage that helps pay your out-of-pocket cost, like your 20% coinsurance. Part A, Part B, you can add Part D. You can also add supplemental coverage. It can help pay some costs that original Medicare doesn't. This includes Medicare supplement insurance, Medigap. Go to page 75 to learn more about Medigap, or you can use coverage from a current or former employer or union or Medicaid if you qualify. Okay. And then if you do Medicare Advantage, also known as Part C, a Medicare approved plan from a private company that offers an alternative to original Medicare for your health and drug coverage. These plans bundle together your Part A, Part B, and usually Part D. You may need to use doctors in its network and get approval for certain drugs or services. That seems to be how health insurance, that's kind of how it works for me now. Usually have different out of pocket cost than original Medicare, including a limit on out of pocket costs. You don't need to buy supplemental coverage like Medigap. Most plans offer extra benefits that original Medicare doesn't cover, like vision, hearing, dental, and more. So that's what's the catch, right? If something sounds too good to be true, it usually is. You might need to get a referral to use a specialist, but I feel like that's kind of how insurance works now. You can use any doctor or hospital. You may need to use doctors and other providers who in the plan's network. So that's how my insurance is now. Like I can't go to hi Joy. Thank you, thank you, thank you. Um, I can't go to Kaiser. It's like UCLA Medical, but it's under Cigna. So I can't go anywhere. And they're like, when I was gonna go to my hand specialist, I had to make sure that they take the insurance. But maybe when you're older, you don't want to mess around with that. It seems to me on a very first glance that the Medicare Advantage Part C seems good. But let me know. You can't buy Medigap to cover out of pocket cost. However, you may be able to use coverage from a current or former employer if you qualify. So, what are some of the changes, though, and income limits? Interesting. Medicare.gov for the income limits. Get started. Sign up to get important reminders. What age? I don't know. I don't know. What age can you get Medicare? Age 65, or in some cases earlier if you have a qualifying disability, such as receiving Social Security disability benefits for 24 months, or if you have end stage renal disease or ALS, Lou Gehrig's disease. Most people are eligible when they turn 65, while some receive it automatically if they already get Social Security benefits. Hmm. You may qualify for Medicare before turning 65 if you have one of the following conditions: Social Security disability benefits. You've received these benefits for 24 months. I have another person in my life who's been sick for almost a year. And I wonder, but he's young. He's younger than I am. And it hasn't been 24 months. I don't know if he's getting Social Security disability. I know that he's getting something. And if you receive him for 24 months, so if it happens for another year, he would potentially be eligible even though he's really young? Okay. Why are people concerned about fluoride, about the changes to Medicare and Medicaid? Let's look at the AI overview. People are concerned about recent changes to Medicare and Medicaid due to the potential for significant coverage losses, increased cost, and disruptions to the healthcare system. For Medicaid, this is driven by the unwinding of pandemic era protections and recent legislation imposing stricter eligibility rules. For Medicare, concerns arise from the growth and operation of Medicare Advantage plans and the effects of recent federal legislation. So now that's very interesting. So in the very first paragraph there, so when I was just looking and I was comparing the 2 plans, I was like, "Oh, Medicare Advantage seems awesome." But they're saying that that's part of why people are concerned. So, it does look like Medicare Part C is more private. They said like, "Oh, it's provided by someone else, and it combines Part A, B, and D, and that you don't have to do gap insurance." So, um, it's interesting though. Okay, concerns regarding Medicaid. The end of the federal public health emergency and subsequent unwinding of continuous enrollment provisions has led to a greater disenrollment. Widespread coverage loss. Since April of 2023, over 25 million people have been removed from Medicaid rolls, with a large majority losing coverage for procedural reasons, not because they were found ineligible. Most of these people, including eligible individuals and children, became uninsured or experienced coverage gaps. The great, oh, interesting. Since unwinding began. Okay. Procedural hurdles. Concerns including administrative errors, complex renewal paperwork, language barriers, and communication failures that made it difficult for eligible people to retain their coverage. Some states mistakenly disenrolled children by assessing eligibility at the household level. Staffing shortages and backlogs. State Medicaid agencies facing staffing shortages and outdated technology were overwhelmed by the workload, leading to renewal backlogs and delays in processing applications. Work requirements. Upcoming federal legislation known as the One Big Beautiful Bill Act, the The OBBBA will impose work requirements for most Medicaid recipients starting in 2027. Critics worry this will lead to millions more losing coverage due to the bureaucratic difficulty of providing compliance. Disproportionate impact. The unwinding has disproportionately affected communities of color and other vulnerable groups who face more barriers to healthcare access. Concerns regarding Medicare. The growing prominence of private Medicare Advantage (MA) plans and the passing of the OBBBA have fueled concerns among beneficiaries and advocates. Prior authorization and claims denials. MA plans frequently require prior authorization for treatments and medications, leading to delays and denials of medically necessary care. Studies by the Officer of Inspector General have found that MA plans deny legitimate claims that should have been covered by Medicare. All right, so there's when I was like, "Oh, this looks good," but when something sounds too good to be true, it usually is. So that's the issue, according to the AI overview, is that the private plans that are potentially less money are denying coverage for things that shouldn't get denied. Okay. Restricted provider networks. Unlike original Medicare, MA plans operate with restricted provider networks that can change annually. This can force patients to switch doctors or pay higher out of pocket costs for out of network care, a significant issue for those in rural areas or who travel frequently. Taking another sip of coffee. High out of pocket cost. Despite sometimes having low or $0 monthly premiums, medical advantage plans can have high annual out of pocket maximums. In contrast, original Medicare enrollees can purchase Medigap policies to cover most cost sharing. Misleading marketing. It's even in the book, though. Like, I only read like page 1 of the book and I was already like, oh, this sounds good. So who's doing that? Who's doing the misleading marketing? Is it Medicare? Aggressive and deceptive marketing tactics by MA plans can lead seniors to enroll without fully understanding the limitations and potential cost, especially since it can be difficult to switch back to an original Medicare. Okay, so I take back everything that I just said. Don't do that. Stick with original Medicare. That's the new thought process. Legislative, no wonder it's so easy. Like, because most people are going to do what I just did, if even that. You guys, some people do not read these at all. And this is the one thing that I'm pretty good at, right? Is breaking down the this and that, like, and figuring out which is better. At my job, I explain to my coworkers that we offer different healthcare plans, and I'm really good at being like, okay, so this means if you had a catastrophic incident and you lost a limb, it would be covered and you would only pay this much out of pocket. Like, I don't know what's wrong with me, but I enjoy trying to make sure that people actually understand what it is that they're signing up for. And that's why I like the working examples so much. So if any of you have done either the Medicare Advantage plan, the MA plans, or traditional, and why or why not you like it, I would love you to put that in the comments down below or in chat if you're watching this live. Because yeah, like, I like to get those working examples, like, okay, if you lost a limb under this plan, it's gonna end up actually costing you this much, versus if you lost a limb under this plan, it's gonna cost you this much, and while you're managing losing a limb, you're gonna only be able to go to doctors that take your health plan. You might need pre-authorization for, like, the amputation. I don't know, this is just, like, an example, right? But it's really important to make sure that you understand. And yeah, so most people are not going to read it in that detail. Most people are not weirdos like me, where they really like trying to discover what the differences are and to be able to easily explain them to other people. Most people are going to do what I just did and be like, oh, well, this is cheaper. And I'm already used to like having to get prior authorizations and things like that. So no big deal. I'll save the money. And the big deal might be that you could wind up getting totally denied for something that you need because you're trying to so anyway, just be careful. And now after reading just a little bit more, I'm thinking the medical advantage plans are probably not that good. I need to go to like a senior center and like talk to people. I need to volunteer. Oh, I wish I don't think people would do this. I probably wouldn't do this, but I wish I could like go volunteer at a senior center and like really learn about this and sit down and talk to people. And I wish I could film it. But people aren't gonna wanna film, like, their nitty-gritty, like, I'm sure there's some, like, laws that would be broken if I did that, but I think it would really help. Also, I'm just gonna put this out there, if anybody knows a lot about this and they wanna, like, talk over Zoom and share that information, like, maybe we could set something up and do that, and we can make a call. I think that would be really interesting and really helpful. Okay. Legislative changes from the OBBBA. It delays improvements to Medicare savings programs, which help low income individuals with premiums and cost sharing until 2034. The law blocks federal nursing home staffing standards, raising concerns about the quality of care for older adults. System wide consequences. The changes to both programs are predicted to put a strain on the broader healthcare system and taxpayers. Increased healthcare cost for all. Oh, this is what I was saying for about it before, is that if all these people are suddenly gonna become uninsured, it's going to mean that if people need care, right? Like, I like going to urgent care if I've got the sniffles, if I have, like, this thing with my jaw, I'm probably just gonna go to a chiropractor, um, or a dentist, I don't quite know. But it's gonna mean that everybody for everything is gonna wait until it gets really bad. That's thing number 1. People are gonna if they don't have healthcare coverage, they're more likely not to go and seek the care that they need. And then 2, if you don't have health insurance, you're likely gonna wait until it gets really bad, then you're gonna go to the emergency room, which is gonna overwhelm the emergency room staff, which is already short-staffed. Like, I don't know if you guys have been to the emergency room recently, but, like, I've gone with my mom a few times, and sometimes I love my mom, she's funny, but we've literally walked out. She's like, "Well, obviously, they don't think it's an emergency if they're leaving me in this waiting room this long, so come on, we're just gonna go." And sometimes this is after we've already sat there for, like, 3 or 4 hours. But, like, I kind of agree with her, like, maybe it's not that bad. Like, if it like, you they're gonna take because the emergency room, they like, if somebody is bleeding out in a gunshot wound, that's gonna get treated first. Um, like, they treat the people who they see as a priority first, and then they get to the other people that they deem who are less of a priority. So, um, if people are there for things like, "Oh, I slept wrong and my jaw's out of place." Well, it's like, "Lady, you've been eating fine for a week. Like, you can sit there for 20 hours because we're gonna help somebody else." I also my friend ended up having Guillain-Barré disease, which affects like 1 in 100,000 people. He sat in the emergency room for, I kid you not, like 20 hours. 20 hours. And I had joked with him. I was like, "Why don't you just pretend to fall or something?" Like, I'm forever grateful to my own personal doctor because my friend did not have health insurance. And I was like, let's go to my personal doctor. Like, we'll just go. I called her. I made sure that she would see him. She said yes. I was like, we'll pay out of pocket. She never billed me though. And originally, she almost sent him home. And then we were walking to leave and she noticed he was like tipping over. She's like, that's not normal. You need to take him to the emergency room right now. So we left my doctor's office, who never sent me a bill for that consultation. I'm gonna cry about this too. She never sent me a bill. She's been my doctor for a really long time and I like love her. Um, she never sent us a bill. She told us to go to the emergency room. Like, I really believe, like, she saved his life. He had to, like, have, like, his blood cleaned. It was, like, a whole process and, like, a spinal tap and, like, ugh. like a bunch of stuff. He sat in that emergency room for 20 hours. And I was joking. I was like, why don't you just fall and then they'll see you? And he did fall. I was like, I was joking. I was like, why'd you do that? Don't do that. And I was like, you scared me. He was like, I didn't, he's like, I really fell. He's like, that was not an act to get them to see me faster. Okay. Anyway, Richard says, I don't know what changes, if any, are coming to Medicare and Medicaid next year, but I'm very nervous about those potential changes. I'm also, I feel like I have to say this, right? Try not to be nervous about, we can't change it. It's already done. So we're just gonna have to hope for the best. I think hopefully it's just gonna mean maybe some longer wait times in the emergency room. And then Cindy says, if your spouse is still working with insurance, you do not have to sign up for Medicare given certain parameters. The company has to have insurance from certain providers and have a minimum number of workers. Yeah. Okay. We're at our hour mark. So I'm going to close this out in a little bit. But what about somebody? I don't have a spouse. And while our health insurance is very good for like me as an individual, I have a coworker who has a large family and a large extended family. I think of him like a father, but um, he has a large family, and so his wife, I think it's 4 kids, are on the health insurance plan. That thing, like, it's expensive, and if he's not, even if, I just don't know how they would afford it as, like, as time goes on, basically. Um, yeah. Oh, what's going on with my mouth? Anyway, um, so a lot of times, like, even if one partner was working and they're not anymore, the financial burden of carrying the health insurance, like, if your spouse is still working, do you have to be on your spouse's health insurance, or can the spouses do different things? Okay. All right. My coworker is now asking for some things and it's past the hour, so I'm going to head on out for today. I should see you guys next week. I don't know if I'll go live from Ireland. It's going to depend on what my friend does and like the time difference and all that stuff. I usually try and go live from vacation, but I don't know. We will go live next week. I will see you next week. We'll talk more about this. I would love to know more about like anybody's personal. Okay, they can do different things. Thank you, Cindy. All right, thank you for sharing that. I'm gonna try and run some like real examples. Um Sometimes I go really dark. Let me know if this is too dark, but I'm gonna look into maybe like what happens if you get into a car accident and you like lose a limb under the different scenarios. All right. So thank you guys so much for watching Shelly's Millions. I will see you next Sunday at 11 a.m. And as always, if there's a topic that you want to cover on next week's live, just let me know in the comments. All right. Have a great rest of your Sunday, everyone.